I'm here with Rebecca Wittenberg, Dominique Hood, and Tim Cutler to discuss the Postgraduate Year 2 Ambulatory Care Pharmacy Residency Program at UC Davis Health, which received the ASHP Foundation Pharmacy Residency Excellence Program Award. Your program has significantly grown by a resident-led ambulatory service expansion. Can you describe for me how you empower residents to lead these initiatives and the impact on ambulatory care services at UC Davis Health?
I was really fortunate as a resident to be able to have that experience in our rheumatology clinic. And that really helped me with my transition post residency to starting to be a staff pharmacist. And in that role, starting up our infectious diseases clinic. So those skills I learned as part of my residency were really directly transferable to my role starting up the infectious diseases clinic here. And so fast forward a few years later when I became the residency program director and kind of thinking about what experiences do we want our residents to have as part of this program, I really wanted that to be a key part of the experience and program and just build some more structure around that. And so as you can imagine, for a resident taking on this leadership role of piloting a new clinic, that's a little bit daunting at the start of the year. But we really made sure Tim and I actually had kind of talked about what are those pieces of structure that we can build around our residents to help support them through this. And part of that is kind of creating a layered preceptorship role. So we have a pharmacist preceptor that helps our residents through this, and they're kind of the content expert. So, for example, when we were starting to pilot a new clinic in cardiac rehab, we had our cardiology pharmacist kind of pair up and precept that resident and help them really understand, the content of cardiology, how to kind of operate in the clinic. And then alongside that pharmacist preceptor, we also have a leader preceptor. So one of our managers here at UC Davis also helps to precept the resident. And they're kind of thinking from that high level aspect, about how do we really implement these things from that bird's eye view. How do we really coordinate with clinical management, for example, stakeholders that are important across the health system. And so I think with that type of preceptorship, our residents are really able to grow their confidence, grow their leadership skills, and as the year goes on, just really feel more empowered and able to really step into that leadership role.
Oh, I should say, I think Bex and the preceptor team do a wonderful job of providing the perfect balance of supporting and challenging environment to be able to empower those residents to be independent and develop those leadership skills and collaboration skills to be able to be successful, which is ultimately what we want them to take with them into their future careers.
From my perspective, the residents should be an extension of what we do and contribute significantly to our department. And that's a culture that we've really tried to establish here. And when I think about this experience, the management experience in expanding clinic to different areas of our organization, we really wanted to move it from an organic process where it was sort of just, let's do a project, let's build a business case, let's start something, to something much more formalized where we could have structure and a curriculum of sorts that helps the resident understand the different components that are necessary. What's the business case? What's the financials? What's the culture of that clinic that you're going into? What are their needs? How do you identify their needs and successfully work with them to grow that opportunity? What are the organizational goals that line up with that as well, not just the financial piece? And of course, what's the patient experience and contributions to improving and enhancing that patient care that's happening? And so, we start with a month-long management rotation, and then that leads into a longitudinal management block or series, if you will, where we talk about the various ways that you can justify services. And that comes in many different shapes and sizes. And that's not something you can learn just in a month. That takes almost a full year of experience to learn from. But what I think is really great about this residency is, a lot of these residents built clinic opportunities for themselves. And they actually ended up applying for and getting those same jobs that they justified through the hard work that they spent all year piloting, justifying, rejustifying, and then ultimately getting FTE support for that clinic. So we don't lose a lot of our residents. We keep a lot of them. And that's because we grow so much with their support, and we add more clinical pharmacists almost every year to expand the footprint that we have.
I appreciate how impressive this program is, and it's pretty clear that the elements you've embedded have made you and the residents successful. Can you share with me an example of how your patients and your community benefit from the expansion of ambulatory care services?
Yeah, I think something that is really key about having pharmacists in all these clinics and really being able to expand our footprint in the ambulatory care setting is that patients really have much um, patients really have much more easy access to our healthcare providers and really able to, contact pharmacists for the needs that come up, between clinic visits that they have with physicians. Physicians do have limited bandwidth. Sometimes they're only in clinic a half day per week or things like that. But by embedding pharmacists into these clinics, we've really created a direct line from the patient to the clinic or to the pharmacist to be able to call and ask questions that come up. They just started a new medication. Is there a drug interaction? They're having side effects. How do they deal with that? And the pharmacist can really help to triage those and step in and provide, immediate answers to our patients, ultimately making the patient care and treatment plans safer, more efficacious. And I think also really helping out the physicians on the one hand and definitely helping out our patients on the other hand. I think also just, an example from one of our pilot expansions, we took our dermatology clinic, kind of from the hospital-based clinic here at UC Davis and expanded it out to some of our outlying clinics. And those outlying clinics, patients there really hadn't had access to one of our pharmacists before this expansion. But because of this expansion, our pharmacists were able to really do more hands-on injection training with our patients. And so, for example, patients who may have previously just been prescribed a new injectable and kind of maybe been fearful to start that, now has the support of a pharmacist to walk them through step by step, kind of calm their fears, help them with the cost of the medications, all of those types of things. So that they just have a much more, I think, supportive environment and, feel safer to be able to start these medications and ultimately hopefully have like more buy-in with those treatments too.
And, I think that one of the key elements of the high value pharmacy enterprise from Vizient is that every patient should have access to a pharmacist. That doesn't mean every patient needs a pharmacist every day, right? I mean, that, is dependent on their needs, their medications, et cetera. And I think we took that very seriously here at UC Davis. And, we moved away from, a point two, justifying a point two position here or a point one here, and really thought of this as full system. How do we get every patient access to a pharmacist, whether that's in specialty, whether that's for their refill authorization, whether that's for, primary care or population health initiatives, transitions in care? How do we have a process and a structure in place that every patient can have access? Because we know when they have access to a pharmacist, we can help with their financial support. We can help save them money. We can help their clinical outcomes. We can reduce adverse events. And then the downstream effect of the pharmacist involvement is that it can decompress the provider. So now they have better access for their patients to see patients that are new to the system or have different needs that maybe a pharmacist isn't necessary for. So it really has helped provide improved access to the for the system as well as improve outcomes for our patients.
I think in terms of our residency program, it's really also helped our residents and any learner that goes through our clinics to be able to see a variety of patients and see the really diverse patient population that we have in the Sacramento region and also, our very large ambulatory care network that we serve.
Well, congratulations. Thanks for sharing your insights with me. It was a pleasure speaking with you today.
Thank you.
Thank you very much.
Thank you.